that and the role that their gut health was playing in their COVID severity. And when I say COVID severity, we're talking about patients who are in the ICU. So obviously they're much sicker than a lot of the other people that were getting infected with COVID. So this is what he was telling me, that he was seeing a lot of patients who did have the risk factors, but then he saw these patients who really didn't have any risk factors, were younger, maybe just a little overweight, or a higher BMI in the obesity range. So we started talking about treatment medications, and one of the medications that they had been trying in the ICU were medications called IL-6 inhibitors. So let's talk a little bit about IL-6 and what cytokines mean. So we have our immune system, which protects us from basically any intrusion or infection. Our body's extremely intelligent in recognizing when we have something that enters our body that is foreign. And so if you think about your immune system, think of it as kind of like the guardian of the galaxy, where it's kind of alert and looking for any kind of infection, like I said, or intruder. And when it sees something that it doesn't recognize, it releases these mediators to help the body fight. So these mediators are called cytokines, and there's 18 of these cytokines. Each one has a different role, and the roles of each are very complex. But what we do know about IL-6, which is one of these interleukins, is that it's usually elevated in conditions that are inflammatory or anything that's acute. And what happens is, unfortunately, a quick and short release of interleukin-6 is great for the body. The body recognizes an infection or intrusion. It releases IL-6. IL-6 does its job. The inflammatory cells go to attack whatever's going on, and it leaves. And that's the ideal situation that we'd like. Unfortunately, what happens is with people who are high risk, such as diabetics, such as people with heart disease, such as people with obesity, they already have in their body subclinical elevations of IL-6. So IL-6 for them is not something that just came out and attacked. It's already something that's elevated. And unfortunately, that's not good, because the chronic presence of interleukin-6 elevation is an indicator that your body is inflamed or has inflammation. And so what they were seeing with their patients in the ICU was that when they were giving these IL-6 inhibitors, they were finding that not only did these patients have very, very high levels of IL-6, but that they were having some response with these IL-6 inhibitors. So that was kind of where we started having the discussion about the role that our inflammatory response, but also the role of our immune system and how it plays a very significant role with COVID, but also in our gut health, because the majority of our immune system is actually in our health. 70% of our immune system is in our gut. So after my husband and I had this discussion, I started thinking a little bit about IL-6 and knowing that it's elevated in these high-risk individuals, but also kind of thinking about kids, right? And what is it about children that really kind of protected them from getting severe infections, right? I mean, we did hear about these kids that had the, inflammatory response, but for the majority of children, they really were not getting severe infections. Well, along with what my husband and I had discussed, and then I also had a couple of colleagues who were scientists that also had backgrounds in neuroscience, but genetics, we kind of started researching a little bit about how COVID is affecting our immune system, and in particular IL-6. So what we found is very interesting. We started researching information on the gut health of children. And, children in general have a much healthier gut than adults do. And believe it or not, their gut concentration has much higher levels of a specific gut bacteria called bifidobacterium. And children under 10 actually have 60 to 80% of their gut populated by this one bacteria, whereas in adults, it starts decreasing over time. So we started wondering, what is it about this specific gut bacteria that children have such a high level of? Well, it turns out it's like nature's way of kind of helping them build their immune system. So, we have our adaptive immunity and we have our innate immunity. And if you don't know what that means, basically you're born with innate, right? You're born with your innate immunity, but over time, you build your adaptive immunity. And so the reason why we think children have much higher levels of bifidobacterium in their gut is because it plays a huge role in developing their adaptive immunity. And believe it or not, it actually down regulates one of these interleukins called interleukin 6. So interleukin 6, as we said, is an inflammatory responder. And so because bifidobacterium downregulates it and actually upregulates a lot of anti-inflammatory mediators, we think this is what's protecting children. Because of their high levels, their body is able to recognize the infection, send an immune response, and really downregulate everything that's going on, versus adults that are getting sick. And the reason why they're getting sick is because their body is already on hyper alert immune wise, and they're not able to handle the infection. And so their immune system kind of goes out of whack. And so this is really what we're seeing as protective. Now, when we first published this study, unfortunately, we weren't able to have any kind of clinical trials during that time because of the fact that everything was shut down. So we published our study based on previous research on bifidobacterium, and there's actually a lot of research on the benefits of this gut bacteria. And actually, most probiotics will have the two really good strains, which are lactobacillus and bifidobacterium in them. And there's a reason why. It's because they've been studied so thoroughly to be really beneficial for our immune system. So, so we found that, we found these findings, we published them in a review, and it kind of, it was hard to get a lot of traction on it. There were so many things coming out with findings on, what's causing COVID severity, such as vitamin D deficiency. Well, it turns out vitamin D deficiency does play a role. Vitamin D is actually not only a vitamin, but it also is a hormone, and it plays a role with our gut bacteria in the immune system. So there's definitely a link. So the science behind the clinical findings. So we did this research, we published the review on all the findings of bifidobacterium and how it helps in many medical conditions. But then a few other findings and a few other studies have come out since ours that have really kind of validated what we've been saying. There was a study coming out of Italy in August of 2020 that showed some patients that were treated in a hospital in Italy, given the standard COVID protocol, and then another batch of these patients given the standard protocol plus a very high dose of probiotics containing the bifidobacterium strain. And what they found was that those who received both the standard protocol and the probiotic strains had an 8-fold decrease in respiratory symptoms than the ones who did not. Not only that, not one single patient receiving both the probiotics and the standard treatment were actually needed to be ventilated or put on a respirator. So that was one really significant finding. And that was done in Italy by Dr. De Simone, who is a gut health specialist and a GI specialist and a gut health expert. But then, interestingly enough, in January of 2021, so just a couple of months ago, a big clinical study came out of Hong Kong University that was published in the British Medical Journal. And this study actually examined patients who were hospitalized for COVID severity, and they examined their gut. And they found that those people with those severe symptoms actually had gut deficiencies of certain bacteria. And guess which one was found to also be deficient? Bifidobacterium was one of those gut microbes that was found to be deficient in these people who were getting COVID severity. So we have now 3 published studies that are really highlighting the fact that our gut health really plays a huge role in our health. And so we'd love to just kind of get all this information out and show how can we support our immune health? How can we support our gut health? Well, I have to say that the first thing and the most important thing that we need to do is change our diet. And that includes eating a mostly plant-based diet, because that has been shown to be very beneficial for your gut. It helps with gut inflammation. And it really changes the way that our body reacts to certain things. So I would say definitely we focus on foods which are called prebiotics, right? So the foods that we eat plant-based foods that are rich in antioxidants are prebiotics, and those are number one in how we support our immune health. Number two, I would say probiotics, right? And so we want to take a probiotic, either an edible probiotic or a supplement form. And when I say edible probiotics, I'm talking about foods that are rich in probiotics, that are rich in bacterial culture, such as things like fermented foods, things like kombucha, things that are like miso, kimchi, sauerkraut, all those things that are rich naturally. Kefir is another really big one, that are rich naturally in edible probiotics, and then supplement form. Because our end goal, and I hope I'm not giving too much information or confusing everyone, but our end goal is really postbiotics. And so what does that mean? What is postbiotics? Postbiotics are the byproducts of probiotics. So if you think about probiotics as employees in a factory, so probiotics are our gut bacteria, they're the employees. They feed on prebiotics, right? So they feed on the plant-based foods that we have. That fiber actually helps them work better. And what they do is they produce a product, and that product is a postbiotics. And those are short chain fatty acids. And what those do is they actually help to support our gut and the integrity of the gut lining so that it doesn't lead to inflammation. Because gut inflammation over time and over years, what happens is gut inflammation ends up leading to systemic inflammation. And systemic inflammation, when you start seeing those problems like diabetes and heart disease, because of the fact that our gut is inflamed and not as healthy as it should be. So I'm really, really happy because, you know, for a long time, and I know Jabin and I had discussed this, New Skin had a probiotic, but they didn't have anything that had the bifidobacterium strain. And so I was really excited when he told me that they just released a new probiotic for children called Defendables, which has not only the lactobacillus strain, but it also has the bifidobacterium strain. And so that's something that I can actually say, you know what, this is a really good probiotic to take because it has the two strains in there. And it is for children, but you definitely can take it as an adult and double up on the dose. And you know, this is really something that I think in the next 5 years, gut health is really exploding, and we're finding so much research on the benefits of gut health. But you know, most importantly, I would say food and the way we eat, but also probiotic supplements. So this is really all I have to say. I don't know if anyone wants to ask any questions or anything like that.
So yes, so thank you, for your, scientific presentation for this kind of the, gut health, gut health. Nobody, as before, maybe not too much people notice this is very important, right? Every day is for the daily life. So
Yeah.
that's the reason, how can we, understand this kind of gut, health, and try to improve our lifestyles to improve this kind of the health conditions. So this is very critical sense. For the that's called the defendable, this is for the kids, as you mentioned. So there is a 4 bacteria in this defendable. So for the adults, there is adults that's called the probio PCC. This is only 1 bacteria. From the adults versus the children, I just want to know, compared to the let's call the gut health, this kind of the bacteria, how different from adults to the children. So how can we, use the children's let's call the defendable to enrich, this kind of the bacteria in the adults.
Yeah, and I want to stress that every bacteria in our gut really plays a role. So you have to be careful, and you have to give them in tandem. You can't just give one. It kind of doesn't work that way. But in this case, supplementing with bifidobacterium is definitely beneficial. And actually a study that we found when we were doing our research had shown that, we know that the levels decline as we age. We know that they're lower in the elderly, but oddly enough, there was one study that did check the gut and centenarians who are Japanese and Italian centenarians, who are people who obviously live to be 100. And they found that their gut concentration of bifidobacterium was actually higher than the non-centenarian elderly population. And so I don't know if you watch the news, occasionally there's like, a 100-year-old or like a 90-something-year-old person who was infected with COVID and they managed to survive, right? And they're released and everything's fine. But then we're seeing these other people that really aren't doing so well. And, that's like, it's a very imbalanced result. And so we're finding that, those people who really have, better gut health are faring better in terms of COVID severity. And maybe COVID was kind of a wake-up call for the US especially, because we did see so many patients who were so sick. And so maybe it's a wake-up call because, we are eating a country of 2% obesity right now, and we eat a lot of processed foods, so it's definitely something that I think is worth exploring and helping to improve everyone's health.
Can we ask, there's a background noise, can we just ask the person who's speaking, please mute yourself, please? The phone that starts with DJX. I guess, Christine, you're the only host. You can mute.
Sure. Let me see.
Yeah, we're gonna have to put everyone on auto mute.
Yep, no problem. I think
everyone's
on mute now.
Thank you.
Sure. So.
Right. Christine, I do have a question. I think that sounds great. I think that ideally we all take multi-strain probio would be ideal. But I guess if it's a chewable that's suitable for kids, then I would assume that it's probably also safe for adult to take, right? Or is that the wrong assumption?
No, I think it's fine to take. I think the dosage recommendation is 1 for each child.
It's one chewable tablet. I'm looking at the product information page, and then it says it's a 5 billion CFU, but I guess
we could double up. I mean, really, believe it or not, the studies in Italy, they were based on 800 billion that they gave to patients. So you can really go up on the dose. It depends on the situation. If you're doing it as maintenance or prevention, it's fine. You can take chewables, but this is like, again, like a disclaimer, this isn't a COVID treatment. This is more about improving your gut health, right? And just taking action to really improve your eating, but also kind of supplementing as a second kind of thing. So
yeah, absolutely. Although it's helpful to, I mean, just conceptually it makes sense to have multi-strain in the system, right? Because
and this is really the trick with probiotics, right? Is because they all have different functions. If I just took bifidobacterium and nothing else, it probably wouldn't necessarily help because we have beneficial gut bacteria, but we also have bad gut bacteria, and so you kind of want to balance your microbiome. And believe it or not, our microbiome is always changing. So, if we travel, it changes. People in different countries have different microbiomes. And actually, there's a study that says that your microbiome varies based on the friends that you keep. So if your friends have, if you're dining with your friends and, whatever, they're eating unhealthy or healthy, it actually affects your microbiome too. They found that people who are like in the same social network actually have similar microbiomes, which is fascinating in my opinion. So.
Right. Understood.
Does anyone else have any questions? I guess you can maybe say it in the chat and then we can unmute you.
So Christine, I have a question.
Sure.
Because as I, let's call it 24 years, internal medicine training, right? So you want to, build up your own global business, right? Try to help people become more healthy. So particularly for the COVID-19, everybody is really facial the treatment. So how can we, as a physician, doctor, why you choose the new skin is the anti-aging, this kind of the platform as your one of the options, business options.
Yeah, I mean, when I wasn't really familiar with Nu Skin up until a couple of years ago, what got me really interested in Nu Skin was their antioxidant scanner, believe it or not, because antioxidants play a huge role in disease prevention. And I really like that they had the scanner that checked to see how your levels are. And, in my opinion, and I think maybe Lily has says it too, like it's a lie detector of your health. If you think you're eating healthy and your levels are low, then you might not be eating as healthy as you thought. So that was really what introduced me to Nu Skin. But then I found that their products are really very good quality. And I started taking a few of the vitamins, and I actually found that my levels started to go up with their vitamins. The nano is great. And so that's one that I've been taking. And again, I want to stress, really, food is the most important thing first. But if you're going to choose a supplement, not all supplements are made the same. And Nu Skin actually has their supplements in the physician's manual, which means that they've been thoroughly studied and investigated. And I think everything is science-backed, which is something that really makes me comfortable when I'm recommending it to my patients.
That's great. Yeah, because the high quality, as a product, they try to help people more. So, from your expert, the gut health is very important. So that's the reason we want to educate, more people to know how to, improve their life quality, lifestyles. So
absolutely, yeah. And that's the problem too, is supplements are not FDA approved, right? They don't need FDA approval. So anyone can really come out there and say, I'm giving you vitamin C 1,000 milligrams, and they could say anything they want, and you might be taking their supplement and you got it cheap, $10, whatever bottle on Amazon, but you're probably not really getting the high quality of that supplement. So you definitely want to go to a source that's been, well studied, and a reputable company.
Yeah, that's great. So does anyone has a question, try to understand more about the gut health and the probiotics, from your daily life? You can ask the questions.
I do have one more question, Christine. So I'm obviously, the age of my kids, right? They're 9 and 12. So for my older one, if I look at Defendable, it's recommended for children 2 to 12. I know that when kids get into puberty, obviously their body start to grow, and then there's hormonal and everything going on. So we try not to interfere with that period. And just let it play out, because it's very complex. But if I really, for Nathan, he goes to school. His school is already fully back to campus ever since last September. Mm-hmm. And so if I just want to kind of double dose, should I just, the product information page doesn't tell me above 12, what do you do? I think it's because it belongs to the teens. So what should I do? Just double up the 2 chewables? What would you recommend?
I mean, honestly, I think it's safe to double up. I don't think it's a problem.
Okay.
A lot of, and the other thing I want to say is, when you take a probiotic, make sure you're taking it on an empty stomach, because I mean, these are live cultures, right? That we're ingesting. And so if you have food in your stomach that's being digested, increased acid production, that might kill off a lot of your the probiotics, right? So you definitely want to take it on an empty stomach, usually first thing in the morning. And that way it kind of has that quicker passage into your colon, which is where you want it. And a lot of the strains don't even survive. So so a lot of, and this is why a lot of companies will either encapsulate their probiotics in a way that prevents the probiotic from being destroyed in the stomach.
Yeah.
And then there's like another school of thought where you ingest the spores. So you mix the spores with water, so that when you ingest it, then, it has like a better way of arriving into your intestines, right? So, and this is why a lot of these studies have been done on huge doses, because of the fact that a lot of the dosages don't survive. A lot of them survive. So, And I don't think there's ever been like a case of a death from taking probiotics. So
Right.
pretty safe to just double up. But, and I know you already do this. I think, you know, first and foremost, again, it's really the prebiotics that you want to focus on.
Right.
Probiotics should always be secondary. So yeah, definitely, I don't think it's an issue to double up. And I think if adults want to take that too, you can double up or even triple.
Yeah, that's so helpful. Yeah, you just brought up a really great point. I kept forgetting asking the question, when is the best time to take probio? We usually take it right before they go to bed. That's obviously after a certain period of after their dinner, but it sounds like it's even better just to do it first thing in the morning then.
Some people take it before they go to bed. I mean, I never say that unless an individual asks me specifically, because I don't know what time your last meal is, right? So like for me personally, you know, I don't eat after like 5 or 6, so I could take it at night. But if you think about it, in the morning, you've had that, you know, whatever, 10 hours where you haven't really eaten anything. It's great to just take first thing in the morning.
Right.
But also, you want to be careful not to take it with things like vitamin C, because vitamin C is acidic. So that could kill off bacteria. So if you're taking like a vitamin C supplement, you might want to just hold off on that, not take it together. So that's another thing that I also would recommend.
Got it. Yeah, we actually do take vitamins in the morning as part of the breakfast, but then I guess we'll just separate out morning vitamins.
Yeah, I mean, if they're eating early enough and you want to just, you know, that's fine. You can just have them take the probiotics at night and the, you know, the rest of the vitamins in the morning.
Got it. Thank you. That's such an important detail. You don't think about it until you actually take it.
Right.
Right. Thank you.
It's funny. I have a few patients that they've been taking the probiotics with the Bifido strain for a while, and then recently did like a gut analysis, you know, as part of my wellness exam. So they get a gut analysis, and it's funny because when you look at it, you know, adults don't really have as high like levels, but in them, you know, their bifidobacterium always comes up as like really high, and it's like higher than the normal population. So, you know, it's funny, like when I discuss the results with them, I always say, look, you're actually like your gut is actually responding to the probiotics that you're taking. So
right. You know, that's a great point. I need to bring my younger one to your gut analysis. My older one has such a big appetite, you know.
Yeah.
I'm sure I probably should do both of them, because it's so nice to be data driven, and actually we've never done one. So I'll just schedule one with you.
Yeah, it's great.
Just bring
the technology that we have now, not only can we check and see what strains are in your gut bacteria, but we can also see based on your DNA, right? Because, you know, we're all so different. You might be somebody that, for example, is okay eating a chocolate brownie every once in a while because your DNA is okay with that, whereas I might not be. And so the really good thing about the gut test that I do is not only do they tell you what strains are in your colon, but they also will tell you based on your DNA, you know, they have an app on the phone. You know, we type in a food and it'll tell you know, based on your DNA, you know, you really should be kind of staying away from this food, or this food is okay for you to eat. So I like that too, because I feel like, you know, health is very, I mean, everyone is so unique, right? The way that we're built.
You know, as soon as 23andMe came out, we just did it right away. Like, you know, our gene tests are all done, even before they were approved by FDA for retailing, because we're just very forward-looking type of people, very technology-oriented. This is great. I would love to know more, because my family actually has a history. So my mom had colon cancer. I just did my colonoscopy a few days ago. So my family, I feel like we just have to very sensible, or, you know, cautious about what goes into our gut. And I'm sure I've passed it on my gene to my boys. That's why we're very preventative. I'll schedule something with you. And we'll dose up on the defendable. Of course, we eat everything else. You know, we have the G3, we have all the, you know, kids vitamins, and then they love the fish oil, which is great for their eyes and brain development. Now the defendables are out. I'm excited.
Yeah. No, I know. Awesome. It's you know, definitely, like I said, just eating is really first and foremost, and then, you know, supplementing.
Yeah, they're already doing that. Yeah,
it's so deficient too. Like what we're eating isn't as rich as it was 50 years ago in the nutrients that we need. So this is why a lot of us really need the supplementation as well.
Right. And then, they're keeping their scanner scores decently, not as high as when we were doing Alive the other day. I mean, I think their scanner scores have come down just because Nathan's school load has really ramped up. His 6th grade, and then his homework is so much more serious now than before. So I think that, and also his sports are much more vigorous. So he needs more antioxidant for that.
Yes, absolutely. I actually found the same. My kids' levels were higher in the summer than they are now. And I think it definitely plays a role. I mean, and then, and again, you have to think like free radicals really play a role in our health as well. All the byproducts of stress and all the things that we're doing and exercise. And that's why it is so important to eat a very plant-based rich diet, because of the antioxidants there and how they stabilize free radicals, biochemically.
Right. Yeah, got it. Thank you.
So anyone has a question?
I think we have a very shy group today. So
But yeah, maybe some people are waiting for the let's call it the recordings. Yeah, that's really interesting, about this kind of gut health, try to prevent some kind of disease. Immune system is a very critical thing. You can just try to help people, right? Because there is no vaccination, vaccine, for the under 16 years old.
Right.
Prevent yourself. So yeah, that's very critical sense. So for the immune system, from your points, how can we improve our immune system, Christine?
Well, in addition to what we talked about with prebiotics and probiotic supplements, you also want to really be careful what you're eating. Sugar and artificial sweeteners can definitely affect our gut. So you want to avoid that. All artificial sweeteners actually affect our gut and our gut integrity, as does sugar. You also want to kind of make sure you're reading labels. The other thing is stress control. Stress definitely affects our immune system as well. Things like what you're putting on your skin make a difference as well. So also very important, because our skin is the largest organ in our body and it absorbs all the stuff, right? And so then that's stuff that's entering our body, and our body sees it. If it's not something that's healthy, it sees it as a intruder, and it stimulates that immune response. Exercise is extremely important as well. So those are all factors that you can do on a daily basis. Even like a 30-minute walk daily has been shown to not only improve health, but also decrease the incidence of breast cancer and other types of cancer as well. It's not something that you have to do like strenuous exercise. Just even a 30-minute walk a day has been shown to be very beneficial.
That's great. Because immune system is very critical thing for everybody. So we know how to improve our immune system. After 40 years old, everybody is decrease. So that's the reason the high quality lifestyle and quality diet, is really can boost your immune system. So that's the reason, we from our platform, we try to help people understand how can you prevent yourself before you got the treatment. So for example, for the cancer treatment is the same thing. After 10 to 20 years, you got this kind of the cancers, it's too late. So before you got the mutations, you need to manage your life, improve your life quality. This is our goal, for your daily life. So today, thank you, Christine, provide this kind of scientific presentation, and we learn a lot. Definitely, this is a great, platform for everybody. Try to understand it, try to learn the management. So thanks for your time again.
No problem. Thank you so much for having me.
Thank you.
Christine, would love to have you back again with a broader audience and then really talk about your practice. What are the quantifiable tests that you do that I've never heard of? I just think that is fantastic. We need to be much more quantitative driven, data driven. I think that your use of scanner and then your gut analysis and and all of those, I'm sure there are more that we just don't know yet. If you let us know, then we know what is already available out there in terms of technology. for people like me with a finance background, I don't really know what is the latest in your field, right? So,
Right.
but we're very, we tend to be intelligent parents and adults. So we need to talk more about this.
Yeah, and you mentioned a couple of things that I do, but there's also things that like even just tapping into your gut brain axis, right? And that's something simple that you can do by just eating certain foods. Like for example, serotonin is our mood neurotransmitter, but the precursor of serotonin we get from food, tryptophan. A lot of people may have heard of tryptophan because it's rich in turkey and it makes people sleep. And actually, serotonin is one of those neurotransmitters that helps to induce like a restful night's sleep.
Right.
When you're deficient in serotonin, what happens is you're not sleeping well, or you're depressed, or your mood changes, or you're anxious. And so how can we prevent that? Well, I do like a neurotransmitter questionnaire, and I check and see what is your neurotransmitter nature, because we're all different personalities. So I might be a little bit higher in serotonin than someone else. And so how do I support that? Because I want to support my health, right? My unique health. So then I want to eat foods that are rich in serotonin, or rich in the precursor, tryptophan, like things like pineapples, really rich in tryptophan, turkey, edamame, bananas. Those are all really rich in tryptophan, and that can help increase our serotonin levels. So things like that I also tap into, because those are something that you don't know, right?
Right.
Acetylcholine is another one. Acetylcholine is another neurotransmitter that controls our motivation, but also our brain speed. So if we're deficient in acetylcholine, what's going to happen is we're going to be sluggish, and we're not going to function as fast as we should. So those, again, choline, right? The whole choline portion of acetylcholine is actually, it comes from fat. So how do we get choline? How do we get more choline in our body? Well, you eat foods that are rich in good fats, right? The unsaturated fats, like avocados or wild salmon, things that are really rich in fat, nuts, things like that. Then you support your unique physique, right? Your unique physical background.
Right.
And you really kind of help to improve your overall health naturally. And really, this is my goal. If anything, before I die, I'd love to just kind of have medicine more root-based focused than endpoint treatment focused.
Yeah, we totally get it. That's our collective goal. Yeah. Thank you so much. Really appreciate that.
Thank you for having me.
Yeah, thank you. Thank you for your time. Yeah.
Thank you so much.
We can talk more. Right. Yeah.
Have a great Friday and the rest of the weekend. I shall find you in New York. I'm going to bring my boys for the gut check for sure.
Absolutely. I'm going to be doing exams in New Jersey too, in Summit. So I know you live not too far. So
yeah, we're right in Short Hills. Should we?
Yeah.
So why don't we just text each other and find out?
Email me. Yeah, absolutely.
So we don't have to show up in your office. You're saying that you're going to.
I'm going to be collaborating with a medical. It's actually not a medical spa. It's like a spa. That I'm going to be doing like once a week, where I come in and do wellness exams, but I also do some natural aesthetic procedures as well.
Awesome. Great. Okay. We'll just meet you in New Jersey then. That's so much easier, to be honest. Okay, great.
All right.
Yeah. Good to know.
Everyone. Bye.
All right. Take care. Bye.
Thank you. Thank you for your time. Thank you, everybody.
Thank you.
Okay. Thank you, Christy.